In final year, I watched Dr. Rakesh Nair's video. I went through them once, and then like to revise, I used the notes in like I just referred to the notes in internship and medicine. I feel because my like the thought out branch is medicine itself, so I did a lot during final year. So I didn't find like I didn't have a lot of trouble like covering it again during internship because I was already well versed with it. He used to start with a topic. He used to start with the anatomy of the topic, then the physiology of the topic, and the biochemistry. And then he used to like tackle each and every pathology, like explaining his pathophysiology, like explaining his symptoms relating to that pathophysiology. So I think if by like going through Dr. Rakesh's medicine notes was like going through these all subjects once again. So like it was a like mixed bag of subjects. Dr. Rohan is like unbeatable. He uh, everybody like the thing is everybody reads like Bailey and Love in their final year. And the thing is, I didn't read a single page of Bailey and Love. I did it like completely from Dr. Rohan's notes, and I was able to sail through surgery questions easily. So
Right.
basically, each and every line of Bailey and Love he has written in his notes, and he has explained it in the way that anyone can understand. And the best thing about Dr. Rohan's surgery are the flow charts. Basically, each and every like because surgery, like even in the exam, it's a lot about the scenarios, like the clinical scenario, then what's the next best step, what's the next best investigation. So like a lot of the scenarios Dr. Rohan does like separately covered in form of flow charts. So like he made surgery very easy. ENT was also great. Dr. Manisha know that I feel the hardest thing about ENT is understanding the anatomy because like these are like the head neck face is the like the part of the anatomy which is like the Achilles heel of every like medical student. Like first year में नहीं समझ आता फिर internship के time पे तो of course भूल जाती है. So like she has done a very good job of explaining each and every like anatomical aspect related to ENT and like comparing with the pathology. So like that
Right.
made it very easy. Like he has not gone straight to the pathological aspect, like all the diseases and all. He has explained the anatomy of each part, that too in a very concise way. So that like kind of made ENT very easy.
Hi everyone, I'm Dr. Abbas, your orthopedics faculty with Marrow, and it gives me immense pleasure to introduce Dr. Nehar. Hi Dr. Nehar, how are you?
I'm fine. I'm like on the I can say it on the top of the world. Like I've like achieved my
Absolutely.
dream of uh like getting into a central institute, and I've worked hard for it. So like I'm
There
very
is
happy.
no place else you should rather be now, right? You are on the top of the world. You should be at the top of the world. You deserve all of this because I don't think you can top that. It's amazing. It's heartwarming to see so many young talent coming out of internship and securing such amazing ranks. We are all at Marrow so happy and proud of you for finding your success. But we are not here for that. We are here to understand what you did differently that got you this result. We want to know your secrets, the secret sauce, the secret recipe that you've been putting in your preparation so that the people who are watching it right now or who will watch it next year should adapt and learn from you and reproduce your result. Will you be kind enough to share your strategy with us?
Yeah, sure. So basically, um, about my timeline, I started around like studying seriously around October. So basically, I had been studying using Marrow like for focusing on my prof exam. So like I had gone through my like third minor, pre-final and final prof notes. So in the internship, I had to start reading the first and second prof. So I did those from like those notes diligently, like first and second prof, and I went to the third pre-final and final prof.
So no, let me
And
get
I
this right. Let
also
me get this right. From third final year and fourth final year, you did those subjects in third and fourth year. In
yeah
internship, you did the first and second year subjects.
yeah.
So in third year,
So
you did your third year ENT of the SPM. And in
yeah
final year, you did medicine, surgery, PD, ops, and gyne, ortho,
yeah
anesthesia, dermat, and psychiatry. Now, let me ask you this.
yeah.
Let's start slowly and go deeper into it. Among all the videos that you've watched, I'm sure all the teachers are amazing, right? But there are a few teachers that stick with you. Who were your favorite teachers?
Uh, to like name some, my top two favorite teachers are first of all you, Dr. Abbas. I've been a subscriber to your channel. Like uh, apart from like teaching also very well, you are also a great motivator. So I've been following your YouTube posts a lot. And secondly, Dr. Rohan Khandelwal. I feel the way he has covered the standard textbook, he has covered it very well, like in his notes, in his videos. So these, like to name, these are my top two teachers.
Amazing, amazing. I'm so honored to be in his class. The point I'm trying to make here is that in final year you had four major subjects to pass your professional exams, right? Medicine, surgery, pediatrics, and odds and kinds. Ortho was an additional subject. You have dermat and psychiatry and anesthesia questions popping in somewhere or the other. So how was your final year preparation like? That helped you prepare your prof exam as well as get you ready for your INSET exam.
So in final year, I approached it the basic way. I saw the videos of a particular topic. Like let's say just a day before, like when there was no COVID, I used to watch it a day before my posting. Or in COVID, I had like let's say 6, 7, 8, 9 months, like let's say 9 months for me. So I watched like a few hours every day, and then I used to do those notes and like
You
the
prepared your own
related.
notes, Nehar, or did you buy the printed notes?
Uh, Actually, I am not a like a excellent note taker. So what I used to do, I used to make notes, but then it uh, for my like my final revision, I mainly used the Marrow notes which were available with the lecture. So I used to go
So
through them.
essentially, assume that you did not make your notes because that's what you did not use to revise, na?
Yeah,
So you had the printed copy with you, or did you use the PDF on the app?
I used the PDF on the app.
Okay. So you would follow the lecture while the teacher was teaching on the notes.
Uh, yeah, like for first and third minor and final prof, I used to do that. But then for first and second prof, not so much because I had very less time in internship. So only the topics which I was very weak in, I used to do
Okay.
it for them.
Awesome. Awesome. So what you did was in third year and final year, because you had time, you watched the videos with the notes side by side, and you would use that and revise that and go for the exam. And when you were in the internship, you went back to first and second year subjects, just quickly watched the videos and moved ahead. Now, the problem is if you only watch the videos, Dr. Nair, you will not have any place to consolidate your information, right? So, what was your source
Hmm.
for review? Was it the question bank now, or was it the notes, or how did you review the information you accumulated, or was it the notes that you had in your professional years?
Actually, to be frank, I didn't like go back to those notes a lot. My main source of reviews was my GT questions, like the
Excellent.
GPs which I gave, which started from like October, November and went on till like March. I gave those GPs. I like followed the course diligently. Like there used to be a GT every like twice a month, so I used to give every each of them. And what I used to do, like the questions I couldn't get, I got wrong, or I skipped them, or like I guessed them correct, which is like a very great option that the Q bank has. Like you know which questions you guessed right, so like you
Guess
can go
tracking,
back to
yes,
them
you
even
can
if you
track
get them
your guessing.
you get you can get them right. So like what I did, whenever parallel to what I used to read, I used to like revise my GTs and the topics which I was weak in. I went back to the notes and I did them thoroughly.
Okay. Okay. Now, what about medicine? Medicine, a lot of people find enormous. People think it's an ocean of information. How did you cover medicine in final year from Marrow?
So again in final year, I watched Dr. Rakesh Nair's video. I went through them once, and then like to revise, I used the notes in like I just referred to the notes in internship and medicine. I feel because my like the thought out branch is medicine itself, so I did a lot during final year. So I didn't find like I didn't have a lot of trouble like covering it again during internship because I was already well versed with it. So like medicine, if you ask me, the bulk of it I did in final year, and during my internship I just depended on my memory and the questions which I didn't used to get in medicine.
No, keeping aside the fact that you're passionate about medicine, in terms of medicine as a subject, Did you find it to, did you find it valuable to help you answer MCQs on the exam?
Mm, uh, like yes, like the notes were like very concise. Like there were like a few questions which I could solve using medicine, like uh, uh, about the like common stuff and all, like the clinical approach and also. Yeah, they were.
Mhm. Medicine is basically integration of multiple subjects, subjects coming all the way
Hmm.
from physiology, pathology, pharmacology, microbiology, and whatnot. And a lot of people
Hmm.
say Dr. Rakesh does an amazing job integrating all of them. Did you feel it in his
Yeah,
teachings?
he he did like from what I remember, whenever he used to start with a topic, he used to start with the anatomy of the topic, then the physiology of the topic, and the biochemistry, and then he used to like tackle each and every pathology, like explaining his pathophysiology, like explaining his symptoms relating to that pathophysiology. So I think if by like going through Dr. Rakesh's medicine notes was like going through these all subjects once again. So like it was a like mixed bag of subjects instead of like
Mixed bag of
just
subjects,
being
multiple
one
subjects. You
subject.
can get access and review multiple subjects and whatnot. And coming to surgery, surgery is a subject where it is expected of you to understand a lot of anatomy, and yes, it is conceptual to an extent, but it's factual also to a certain amount of to a certain extent. How was surgery with Dr. Rohan for you?
So he's like Dr. Rohan is like unbeatable. He uh, everybody like the thing is everybody reads like Bailey and Love in their final year, and the thing is I didn't touch like read a single page of Bailey and Love. I did it like completely from Dr. Rohan's notes, and I was able to sail through surgery questions easily. So basically, each and every line of Bailey and Love he has written in his notes and he has explained it in the way like anyone can understand. And the best thing about Dr. Rohan's surgery are the flow charts. Basically, each and every like because surgery, like even in the exam, it's a lot about the scenarios, like the clinical scenario, then what's the next best step, what's the next best investigation. So like a lot of the scenarios Dr. Rohan does like separately covered in form of flow charts. So like he made surgery very easy.
Okay. How about ENT? The ENT is one of those subjects, again, a lot of students find it confusing, and it is something that you are prepared in third year, and by the time you finish your internship, you would have forgotten. How was ENT for you?
Hmm. Like ENT was also great. Dr. Manisha know that I feel the hardest thing about ENT is understanding the anatomy because like these are like the head neck face is the like the part of the anatomy which is like the Achilles heel of every like medical student. Like first year में नहीं समझ आता फिर internship के time पे तो of course भूल जाती है. So like she has done a very good job of explaining each and every like anatomical aspect related to ENT and like comparing with the pathology. So like that
Okay.
made it very easy. Like he has not gone straight to the pathological aspect, like all the diseases and all. He has explained the anatomy of each part, that too in a very concise way. So that like kind of made ENT very easy.
So you are lucky to have amazing teachers teach you all these difficult subjects in a very simplified manner. But application of this information that you acquire from these teachers need to be tested with the help of a question bank.
Hmm.
What was your approach with question bank? How would you approach them after finishing a topic or a subject?
Okay, so the way I approach them, like what I used to do, like since I started in the middle of my internship, so what I used to do, I used to approach the PYQs first. So like the all the PYQs I used to solve.
Previous year
Then I
questions
used
first.
to yeah, previous year question. Then I used to make a list of the topics which were asked in the P1Q. Then what I used to do, I used to solve the QBank modules of these specific topics and like write down the information and like read the modules pertaining to these topics and like see the videos if that like there's any doubt. And then that's it. And also, like recently, Marrow has released a certain like a new feature known as schema, so that which in which each and every topic you have the each and every subject you'll have like the important high yield topics. So that's also a good
So
thing
basically,
that I use.
schema is what you have been doing. So let me tell everyone
Hmm.
what this is. What he explained is so nice. Basically, what Nehar used to do was look at the previous year questions. And after looking at the previous year questions, he would get a good idea of what topics are important. So he would go to the question bank modules of those topics and focus on it, read from there, thereby focusing on the high yield topics first. Now Marrow has introduced something called as schema. In QBank, you will see schema. So in schema, what it does is it basically shows you the high yield topics and the number of questions from those topics in the question bank, and whether you have done it or not, and if you have done it right or wrong. It kind of gives you an idea of you actually focusing on the things that matter or not. Sometimes you might end up doing everything, that is great, sometimes you're not. And when you can't do everything, if you're focusing your attention on things that are not very important, you might not get the result that you expect. So that is what Dr. Nehar has been doing, and now thanks to technology we have that in the app for you to make your life a little easy. Now what about tests, Dr. Nehar? How would you approach tests, grant tests? A lot of students are apprehensive about grant tests. They say ki, I can't take a grant test because I have not finished the whole syllabus. Sir, what is the point of taking a test? Obviously I will get low marks. How did you overcome this, and when did you start taking grant tests?
Basically, I think the first thing that uh, we need to understand whenever we are taking a grant is like it's a practice test, like not the final exam you are going to give. Like whatever the rank you get in the grant test, it just tells you where you stand. It does not tell you your like what will be your final rank. So I think that is the first mindset change people need to have like before giving grant test. And secondly, they need to understand that the grant test is just a culmination of all the 19 subjects, like the important topics and the questions pertaining to them, and use it as a study resource, like a high yield cluster of the important topics. Because the thing about Marrow is that each and every question has like a in-depth explanation with the related pearls, and also basically if you review a grant test, you're like reviewing 200 topics. So basically, main thing about grant test is the review. Like you give it like an exam, don't worry about the rank or the marks you get. The main thing you need to do is review. And basically, irrespective of your rank and the marks you get, if you review the grant test thoroughly, there's no stopping you like from
I will
getting
come
those.
back to review, Dr. Nehar, but the point that you have made might be missed by the audience who are not paying attention. This is an important point. Pay attention. What he said is, if you do a grant test sincerely, pay attention to each question and the options, and then read the explanation, trying to understand why the answer is 1 and 2, 3 and 4 are not the answers. What will happen is, at the end of the grant test, you have basically mastered 200 or 300 new topics that you wouldn't have prepared. So grant test is this skirmish sort of an approach. It's a random approach where you go and do high yield important topics back to back from various subjects, and in no time you will realize that you're overlapping so many areas, but all those areas are highly relevant and important areas. And once you finally come back to the subject and start reading it, if you want to read a specific subject, you'll realize that most of the subject is already covered with your knowledge, because you have been learning it passively and slowly from various other grant tests. I have one of the approaches that I tell my students is a grant test approach. I tell them, only do grant tests, keep on doing grant tests, learn from every grant test, and try to put the answers from each grant test into a separate subject topic or subject book. Thereby you will realize that all the information that you've accumulated from 10 grant tests is equal to the subject that you would have read eventually. Now, how would you review it? A lot of students find it very challenging to review 200 and 300 questions, very time consuming, painful and tedious. आप कैसे करते थे? How did you review those 300 questions after giving a grant test?
Basically agreed, like it is very painful and tedious thing to like review 200 questions and like review those topics. But then the thing is, as tedious as it sounds, it is a very fruitful activity according to me, because you have done those 200 topics. Like the thing is, nobody can now like stop you from getting those questions wrong now. Like you have done those topics in the depth which is required for like answering any question in the PG exam. And the thing is as you go on reviewing grant test, the amount of time that it will take to review a specific grant test will fall, because of course, because you have done the high yield topic for the first time. The same
It will
high
be
yield
repeated.
topic will be
It will be repeated the next
it will
time
be
around, so you would be familiar with it already.
yes,
Excellent. So that's a
you'll be
very good
familiar
start.
with it. And then again, like you'll also the thing is, if you like time yourself, like one thing I also did, I timed each question which I reviewed. So then that also helps me increasing my reading speed, which was also as every like it
Excellent.
was
I
necessary
never
for this
thought of
exam
that.
because
I never thought of that, and I've never seen anybody do that. You were timing your review speed as well. So, what was your average review speed per question or per paper?
okay, so like if you talk to me about a first grand test, I took like 2 3 days to do it. The second grand test was a little less, like 2 days, and the third grand test was 1 day. Like if you ask me, the last grand test I reviewed it around in 6 hours because I knew most of the topics, and then I only focused on the questions which were like kind of were new to me.
Excellent. That
So
is an amazing data point that most of us would have missed. So, as you keep on practicing more and more grant tests, as you keep on reviewing the grant test, you will realize that your time required to review the test also decreases because now you are familiar with those topics. Wonderful, wonderful. Now, what kind of advice would you give your juniors who are watching this video or who will watch this video 1 year or 2 year down the line, in terms of doing the question bank? Any advice that you have specifically to deal with the question bank?
okay, so to deal with the question, basically, you have to look. The way I used to deal with the question, I also followed it during my INICT exam. The first thing is basically now, if you see NEET and INICT, the questions are now linear. So a lot of time the answer is in the last line. So always read the last line first. Understand what the question is asking. Also, it is very important to see is the question asking negative or positive because, like, I have seen examiners nowadays they love to play with English. Like, all of the following are true except which of the following is not false. So, like, see whether the question is asking positive or negative, and then read the question like line to line. Understand what the scenario is trying to tell you and what is asked of that scenario. Then look at the four options like read each and every option correctly and mark the option which you think is the most correct. My strategy was if I can rule out two options and then I'm like down to 50-50. So I used to mark the option which I thought was correct and I used to attempt that question. And then in the exam I reviewed my paper twice. So in the second review, what I used to do, I used to read like since I have gone through the question once, I used to know what the question is asking. So I used to see whether I or not I have misread, like misunderstood the concept of the question, and then always like I have my seniors have told me like each MCQ is one right answer and three wrong answers. So I used to see whether the answer which I have marked fits into that scenario and why the other three options don't fit into the scenario and why they are wrong answers. So that kind of reduces a lot of these mistakes we call as silly because I feel those are the ones which either make it or break it in terms of competitive exams.
So, two
That is,
important things that you have mentioned, Dr. Nehar, I want to, circle back to that. Number one is the examiner plays with the words and the language that is there. And number two is that you have to kind of be familiar with the traps that the examiner sets up with in terms of the options provided in the question. My question to you is, doing the question bank with Marrow, has it prepared you for these kind of exams?
yeah, because I think a lot of the questions in Maro, like especially if you see the mock, the INICT mock, it was set in such a way. So like I was like familiar with like looking at the last line, like the last like trying to confuse you and the options. Also, like even in Marrow, like there were a lot of questions with confusing options. So like doing Marrow questions over and over again kind of made like kind of made a subconscious skill like how to differentiate between two like confusing options because
So
this
Marrow
exam like
subconsciously
I
prepared you for the real exam in terms of the style of the questions and in terms of the caliber of difficulty that you are facing in INISET. Excellent, wonderful.
agreed, yeah.
Any hobbies that you had to sustain you to help you survive this anxious and stressful period before the exam?
Okay, so like in hobbies, I don't like sports, so I don't play a lot of sports. I listen to music and and I'm a avid gamer. I play a lot of video games. So I
What
used
kind
to
of
play
video games
video
do you
games in
play?
my free. I have a PS4, so like I used to play a lot of let's say FPS or RPG games,
Which RPG did
so
you
like
play?
Counter Strike, those kind. Uh, let's say there was RPG like there was like a recent game based on a samurai. Like there was like Ghost of Tsushima, so I played that.
Ghost of Tsushima. Yes, yes, awesome. I played it on my PS5 also. Amazing. It's an amazing game. What about sports games? Any kind of sports games, racing games?
Actually, actually, like I am a very atypical person. Like in my 23, 24 years of life, I wasn't, even though a lot of my friends and family, they were like avid fan of sports, I was not able to make an interest in sports. So,
I said sports
like
games
sports
on
game.
PlayStation. I said sports games.
No, I no.
No, no.
Yeah,
You wouldn't want to touch
just the
sports
same.
with a 10-foot pole, whether it's a game also. I see.
Yeah.
Well, it was so nice talking to you, Dr. Nehar. Thank you for sharing your strategy and insights in terms of dealing with the question bank and videos with your juniors. I am so happy that you got rank 4, and would like to congratulate you on behalf of the whole Maro team, all the faculties, the tech team, the QBank team. We are all so happy and proud of you. You have brought us. Uh, You've made us all very happy with your success, and I'm sure your parents must be very happy and proud of you. I wouldn't want to keep you long. We know that you're out there celebrating and enjoying your time. I wish you all the best, and thank you for giving your time.
Yes, thank you so much, Dr. Abbas. It was a pleasure interacting with you.
All right. Bye bye.